All right, welcome to another podcast. Today, we have one and only Dr. Evans, who will be chatting with us about a journey. Dr. Evans, thank you so much for making the time. I know that you just came from vacation, but you just found this time to chat with us today about your journey. So, again, I appreciate you.
Of course. Thank you for having me. I'm really excited to talk about surgery, which I never get to do. So thanks for having me.
Of course. So, just to start out, can you kind of tell us a little bit about yourself and where you're from?
Yes, so my name is Kamilah. I am in my last year of OBGYN residency, which is obstetrics and gynecology, which is a 4-year residency. I'm doing that in Chicago. I'm originally, though, from Los Angeles, California. I lived there for 10 years. I have moved around a lot, which I think is a very common story with a lot of people in medicine, surprisingly, depending on where you get accepted. But I moved from LA to Texas for family, and then I trained in New York City for medical school, and then I matched in Chicago for residency. So I've been almost in every major city.
Nice, nice.
Yeah.
So just take us a little bit back to your journey early on. Did you know you wanted to be a doctor early on when you're growing up, or was this something that came out a little bit later?
It's a good question. I feel like I didn't know I wanted to be a doctor. I was kind of had like a perfect childhood in the beginning. Both of my parents are actually physicians. But there are those doctors that didn't want you to become a doctor, so they're like, do anything else. And they were the doctor, they were really great at parenting. They pushed me to do the arts, and so I was into really the arts and performing and plays for a while. But then reality hit when my mom passed away, and seeing your mom, who was a doctor, go through 6 months in the ICU, passing away from a septic shock from a surgery, just really changed my. I mean, you can't go back to the arts, right? It's like your perspective changes. And I didn't know what type of doctor I wanted to be because I never really had a super interest in like science, but I knew I wanted to help people in that way because I was there every day. And so, through a very long drag story that I'm not going to go into, found the love for women's health, which was my little corner of medicine that I was really excited about. I don't think I actually like was thinking about this. I don't know if I would have been a doctor had I not found the field of OBGYN, because I felt like it's like the perfect little combination of everything I really like. I'm a sociology major, so I think women's health really pulled at my heartstrings when it came to like how I could help people medically and how that directly impacts people and their relations in society. I felt the direct pressures of like abortion care, abortion providing, even just like prenatal care. There's so many pieces where sociology is like seamlessly and almost like intertwined the field of medicine. And then on top of that, I'm a surgeon. So it's like, it's just this crazy field that I didn't really actually understand the gravity until I was probably like sub-I, partly because I matched during the COVID era. But yeah, I did not know I wanted to be a doctor, but I think life led me here. And now that I'm here, I realize I'm supposed to be an OBGYN. It's a kind of a weird thing.
Yeah,
I did like other fields, so I liked ER, but I just like I couldn't. Like I just really wanted to do this. So that's
yeah,
my long story short.
nice, nice.
Yeah.
So from high school to college, what made you choose sociology? Did you kind of, it sounds like most of your stories, like now that you're looking back, you're like, huh, that fits very perfectly. But did you kind of
Yeah.
know sociology was going to help you decide all these major decisions in the
Yeah.
future?
No, I had no idea. And that's the thing. Life will lead you if you choose the things that you really are passionate about and you're careful about. And you don't even realize that one decision is going to be that one thing that's going to unlock a door 20 years later. And so I always say, even if it's not like I wasn't this big actress, I didn't like, I wasn't trying to be this big performer, but what I did do was I just wanted to have a creative outlet during my pre-med classes because I was trying to see if I was going to be pre-med. I was that fake pre-med, like in and out of classes, not really committed, not really studying for the MCAT, like fake acting like I was that girl, but really no, wasn't committed. And then on top of that, I'm a creative person. I have a right side and a left side of my brain. And so I decided to sign up for Vagina Monologues, which is like this actress show that I was just doing it because I wanted to perform and I wanted to have a creative outlet. Little did I know, this is full story, that part of that casting required us to go through doula and midwife courses to get more in tune with our own bodies, to get to divide and kind of conquer our own monologue within ourselves, to like connect with our wombs. Like it was like the first time I've ever saw my pelvis as like
Wow.
something. And it was through acting courses, and we went through like 6 sessions with these ladies. And I said, this is where I want to be. This, I don't know where. I didn't, and I still didn't connect the dot that I was going to be a doctor. But I was like, I could feel all the different paths of women. And I was like, they're so broad. And some of them were medical. And then I was like, oh my God, maybe I could study women's health. No, I still didn't know that I was going to be an OB-GYN. And I still didn't understand the field of OBGYN, which is so much more than babies. And, there's just like so much more to it. So I did not know that me signing up for that little creative expression as a senior in college that probably was distracting me from my MCAT studying led me to be an OBGYN.
Yeah, that's amazing. That's a good story.
Yeah.
I
Thank
feel
you.
like,
I'm like, I'm glad it worked out. The rest would have just been like another extracurricular.
yeah. I feel like most of us sometimes it's like you have, once I do one and it's going to be two, it's going to be three. And it's good to kind of see how your story kind of just, blended in and it kind of made its own path. And it's like a beautiful just journey. So that's pretty cool.
Yeah. That's why I
Um,
like to emphasize the non-traditional journey. Sorry to cut you off.
no,
Because sometimes it's more than just like, oh, I didn't take my MCAT right out of pre-med. Like it's really about a mindset and a mentality to medicine and what people accept as what you have to do to be a good doctor, like good hands and all the internships and the research papers. And when you come down to like residency and you're on these floors and you're working the same way and you approach and your way to medicine was way different than that, you sometimes feel like your path isn't validated or that you are going to be caught one day and that this isn't really like what it was supposed to be until you realize like, oh, like every path that gets you there, as long as you pass the steps, right, do the work, path is just as validated. So I really encourage completely non-traditional paths to medicine. Not saying that you have to be different, but if you are different, it is extremely valid and probably better for the diversity of the field. Because like we don't need 1,000 research papers to really contribute to medicine. We need creativity and art and like mind
yeah.
function in the OR. Like there's just so much to it. So I do highly encourage non-traditional paths to medicine, even to paths like surgery.
How do you feel like your acting and your creative outlets that you have had impacted your surgical training?
Yeah.
Because I can just see that, because you were talking about how, you don't just need another resident who's just like perfect, USMLE
Right.
scores, amazing research papers. Because what we realize now is like we're actually treating patients now. We are out here, and it's not just about you knowing what the right treatment is, but it's like how do I talk to people?
Yeah.
How do I comfort you
Literally.
in this certain moment? And it's like it's a whole art, I would say.
Oh
And
my
so
gosh.
I'm
Yeah.
curious how you feel about your creative background has
Yeah.
impacted your current
I think that's
you.
what's missing in medicine, like people that embrace their creativity because like you can learn all the steps, you can chat GBT, the dictation, like you can do the things. And I'm not saying medicine is not hard, because trust me, we both know it is extremely hard. You gotta show up, you gotta work, you gotta learn, you're up all day, all night. But once you're in that OR, that's probably the place where you have the most creativity in medicine because everybody and every person that we're working in is totally different. Like, I have never seen a human body that is the same. And so you cannot take a pragmatic step 1, 2, 3 approach to somebody's body that doesn't have that step 1, 2, 3 because it's just gone. It's just not there. We don't know where it is, or it's doubled, or it's like over to the right. And it's like, what is going on? Like, you have to really, and I think the best surgeons are the ones that think on their head. They're not scared to improvise. They're not scared to use their team and like understand the person's needs. Like if you don't even know what that patient wanted before they got in that OR and they're already under anesthesia, you cannot figure out what is the best next step. It is even a shared decision in the OR. But if you don't know how to talk to your patient, like it's like you don't even understand what the goals are. You can consent them all you want. You can talk about the risk benefits and alternatives. And you can say like, okay, this is a really good example. So I had a abdominal myomectomy patient that had big old fibroids, like all the way, like 20-week size uteruses all the way up to the umbilicus.
Oh my gosh.
And she had a kid before, so it wasn't like she was necessarily like, this is like, I really, really want to keep my uterus to have more kids, but she wanted the option. She just wanted the option. And I was the one that counseled her, right? We go in the rooms, we're counseling them, we're consenting them, we're telling them that's a 30-minute visit. And I remember her being like, I said, if it came down to it, because you have so many fibroids, like there's a chance you're going to lose so much blood. You're definitely going to get a blood transfusion. Like I just tell all my abdominal myomectomy patients that I'm like, sometimes there's a point where we're trying to take as many fibroids out. And sometimes there's so much blood loss that the only way to stop the blood loss is by doing a hysterectomy. So I want to know what your goals are. And that comes through, first of all, like you're making this amount of connection and trust within like 5-10 minutes. That's not improvising, but you are definitely like, you're going to have to get your patient there. You're
Yeah.
working with them. And so, like, all that, like, social skills and all that, definitely learned through the arts, through creativity, through pushing myself through ballet and all these things and just knowing how to work with people. So now, 10 minutes later, I know exactly I know exactly what we're really talking about. You want to keep your uterus, and if it came down to it, you would save your life with the uterus. That's it. So I know what my cutoff is. So we get into that OR, and usually it's an attending that's never even met the person, right? When you're like, I don't know how your residency works, but we have attendings that gets just signed up on days, and then they kind of come in, and that's your first time
Hmm.
meeting them. But I know the patient because I'm the one that was on that rotation. So we're in the OR. We're doing this crazy abdominal myomectomy, like over 100 fibroids removed, just like lining them up on the table. And there was a point where we could not stop the bleeding, like I said, like I figured. And it was really because we couldn't find the right stitch. Like the stitch, just like every time we tried to close, like it wasn't like we were trying to find these fibroids. We were just trying to close, and then there's another fibroid right there. So you got to take it out. You can't just put a stitch through a fibroid; it's going to completely tear apart. So we're like, we literally can't close this lady's uterus because no stitch will hold everything together. And at a certain point, you will end up in the ICU. And then who knows what's going to happen to your brain? Like, you have to just think about these long term consequences. And then my attending was just like, yo, I'm gonna do a hysterectomy. And I was like, no. I looked in that lady's eyes and said, I would not do that unless I saved her life. And
Mm.
technically, this is like, we're getting there.
Yeah. Yeah. Man.
And I remember like just being creative. Like I was just like, what else could we do? Like I just don't think we had exhausted all of our options. And I'm buying time and I'm trying. And long story short, we recommended this like different stitch. It worked. It brought everything together. We were in and out, and like patient ended up being fine.
Wow.
But like, just if you look at the consent form, it says okay with hysterectomy, discussed risk of blood transfusion and need for hysterectomy, patient accepts, right? Like,
Hmm.
if I hadn't really connected with that patient in those 10 minutes and understand what she wanted, that would have never been acknowledged. She would have woke up with a hiss, and then they would have said, "You're glad we saved your life." And that is, I think, the difference between like really connecting with patients than the outcome, which is fibroid check removed, you know?
Yeah. That's an amazing story because I can't imagine that patient waking up and then you're
Yeah.
gonna tell her that she can't have kids anymore. I mean, I know she knew the risk, but still.
Right. And you always say, you knew
So
the
that's
risk, you signed your
yeah,
consent.
exactly.
But
Yeah,
it's a
yeah,
little deeper
but
than that sometimes. And I know
yeah,
she would have been okay. She's but like these are the things that we do. And I think if you weren't, if you didn't know how to talk to people, if you didn't even care, if you didn't understand like how people actually like want and live, and yeah, that really is lacking.
yeah. So I want to get into medical school now. I know that's usually, at least for me, it was one of those challenging times because I'm like, man, I'm trying to go into a surgical specialty. Most of them are super competitive, and so you gotta
Yeah.
have good grades and all those kind of things. Can you tell me a little bit about your thought process? You mentioned that you were open for other fields as well, other than
Yeah.
OBGYN. So what's your thought process about picking OBGYN, but also some of the things that you did, and maybe even some struggles that you maybe went through
Sure.
through
Yeah,
in
many of
medical school.
those. Many of those. I wasn't necessarily, yeah, I always had a hard time like labeling myself as a smart person, even until this day. Because I just consider myself a hard worker rather than a smart person, but that's clearly imposter syndrome. But in medical school, I really suffered from that. And I just had to find a way to work smarter because you know that fire hydrant analogy, like it's just you don't have time to learn everything, and I did not do well in the beginning. Like I was barely passing. Then I found my little method, which I preach outwardly to many people on my social media platforms and in person. I even like to the point where my co-residents are like, "Look, Camila, we're doing our 20 questions a day," and I really emphasize like doing a bunch of questions to help with just getting used to test anxiety, which is something I really struggle with, and getting used to learning the material through questions, which I've learned to be a really cool way to actually understand material. And I've learned to just start using questioning through my everyday life. Um, Not really multiple choice, but the way that you have to learn how to pass the test. So once I figured out how to study, I was able to actually like pass with flying colors. And then I was able to get my steps. My step one was pretty average. I'll be honest about my step scores. I think we're pretty, people want to know like what it takes to be an OBGYN. So my step one score, when it was still, I know it's pass fail now, but when it wasn't pass fail, I got a 231, which you really have to, in order to get an interview back in my day, 4 years ago, it would have to be above a 220. And then the average was about a 230, and so I was right there at that average mark to apply for OB-GYN. And then your step two, I really was able to crank up my study method, and I like went to almost the 90th percentile for my step two just through questions alone and like first aid review. I do talk a lot about it on my page. And I was able to honor almost every single rotation my third and fourth year. So I would say just the way that you start does not mean it's the way that you're going to finish. You don't even have to think that you're a smart person. You just have to figure out a way to get the material in your way. For me, what worked for me, questions. I highly encourage it. Even if you feel like you need to study through videos and writing down and Anki, you still have to study for the test. You must incorporate those questions, period. And so once I started doing that, like I was able to really be able to do what I actually wanted to do, which is apply for OBGYN, which is a pretty tough specialty. I did. And I think the reason why I liked other specialties because I dove right in. I didn't say like I just want to be an OB-GYN. I don't care about these other rotations. Like
Mhm.
I don't care about peace. I don't care about neuro. And like sure. But I heard it from some person that said that that's your only time to experience those type of patients. Like you have 6 weeks with these people. That's it. And then you need to learn from these experts. Like people would die to have this opportunity for 1 day shadowing. And so I just approached it differently, got honors, was able to pass all my tests, moved on with my life. But that was not how I started. I'll say that. Yeah.
Nice.
Mhm.
So now you're a COVID resident, which I was too.
Yeah.
I think we graduated the same year.
2021.
Is it
Yeah.
2021
Yeah.
or 2020? I think.
I
Dang,
graduated. Yeah, I started residency in 2021.
21. Yeah, yeah. So
Yeah,
you're a PGY five. Wait, you
I'm a
guys are 4
four.
years.
Yeah,
Okay,
I'm
all
a
right. So
four.
you're
Yeah.
a year. Okay, difference.
Uh-huh.
Okay.
Mhm.
So you're deciding on residency. Did you get to do
Yes.
sub-Is at all during your?
Oh my God. This was like I think this was probably what made intern year so hard for me because I really didn't have an OB-GYN semi. Like I did, but there were no cases going. There was no gyne surgeries, limit labor and delivery. Everybody was very, you know what I'm saying? Like I didn't even have my general surgery rotation. The first day of COVID was 2 weeks into my general surgery rotation. I had no general surgery experience, not even as a fourth year. So I had to make my decision just based off of do I like internal medicine enough? Do I like ER enough? Or do I think I'm going to like surgery? And I really had only been in a few laparoscopic cases. Like I went in a little blind, I'm not going to lie. And so I think
Mm,
it made intern year hard. Seeing the way that I'm working with my med students right now,
mm-hmm.
today, learning how to, they're putting ports in there's suturing. I'm like, I didn't even know what that was, like for real, as a third or fourth year. And I had to really catch up fast as an intern. So I would say my start was rocky. I remember my first day ever coming in with this really not so nice attending at another hospital I work at. He was like, "Are you sure you wanted to do OB?" And I was like, "Yes, I want to do OBGYN. I care about da da da." And he was like, "You should have done internal medicine. You don't have the hands for OB." And I was like, "Dang!" Like first day intern, like clearly, I was so insecure
Damn.
already because I didn't have the exposure. Like that was just our reality. There were no cases going on.
Yeah.
And he told me straight up, like I should go switch to internal medicine. Thank God I had some like or else I would have been right up on out of there. Like, I can't do this. And I was like, boy, bye. Like, everybody worried about you. Um, and now I'll be senioring his cases at the end of this year. So
That's
we'll
amazing.
see. Yeah.
Um, so you match. Where did you where are you at right now?
I'm at UIC, but we are at like, we honestly work at 3 or 4 different hospitals in Chicago, but our main
Mhm.
hospital is at UIC.
I
Yeah.
see. I see. Yeah, same. We here in Atlanta, we work in like every hospital essentially. We
Yeah,
cover the
right?
children's
They just like
hospital.
pimp us
The
out to different hospitals. They're
yeah,
like, go do that surgery, go do that surgery.
yeah. So how has residency been? And it sounds like early on things were rough, but you've kind of found yourself and things are looking better. You're pretty much a chief now.
Yeah.
How has
Yeah.
that been
It's been
going so
good.
far?
Yeah, it's been interesting. I think throughout the years, every year has gotten better, not because it's easier, but because you get better and it's harder every year, but you also get like better as it gets harder. Like it's like this weird doubling of like I just feel like I'm a super saiyan right now. I'm on the top of my game. It was a really rough start. I didn't think in the beginning that I made the right decision. And I think that was the biggest thing to get through was like I just felt like I made a non-informed decision just once again because of my exposure and I just felt like I already ended up in medicine weirdly and so like being in the OR and you know how quickly 0 to 100 the OR can get, you
Yeah.
kind of just have this outer body experience and you're like, why am I here? Like why am I here in the middle of this patient's like extreme moment?
Hmm.
And then you start to find out the reason why you're there because you're actually good at it and you can like help and stop it. There's like, okay, now you start to contribute and actually align yourself with the field. But it took me 4 years to figure that out. Now I feel like I'm about to do one more block of labor and delivery starting next week. Our blocks are 7 to 8 weeks, and then the rest is just purely gyne. So the last 4 months, I'm going to be doing straight up surgery every single day, probably like so many hysterectomies. And I think my big question now is like, what do I do now?
Yeah.
What am I
Yeah.
doing now that I'm growing up and there's no attending to hold your hand, you know?
Are you planning for a fellowship or are you planning on going to practice after this? What's
I am so done with training. I'm ready to. I cannot do even not one more year right now. Maybe in the future. I always had my eye on like intensive care medicine, things like that, just because weirdly, and this is kind of embarrassing to admit, but I will admit this, like because we don't go through an ICU rotation, because we don't have an ER rotation, and our gynonc specialty is considered our ICU rotation, I have
mm,
not coded anybody. Like there's like certain things that I have not done, and sometimes you feel like if you haven't done those things as a resident, you like need to do extra training to get that as a attending, and that's why people sign up for fellowship, which is true. Like you can't see everything, you can't do everything, and I don't know if that's like a good thing or a bad thing for me because I've never been in those situations where I'm the main person needing to code somebody, but um I'm like really interested to see how these last 6 months go. I'm really interested to see the future of the field of OBGYN as there's been talks about splitting it up into just OB and GYN. And some of even the jobs that I've been applying to are already tracking people into either or and supporting your decision to be like, you can only do labor if you only want to do labor. You can only do clinic if you want to do clinic. You can only do gyne surgery without doing MIGS. And so I'm like, I just feel like there's a huge transition in general. And over these next 6 months, I wonder how much I will learn to feel comfortable to be going into these like independent fields. Because once you're the attending,
yeah.
oh my God, it's like a totally different level. I'm probably going to be one of those freak out attendings that's like, checking the chart every 5 seconds after you leave the OR. And the moment they have like some gas, you're running them to the ER. Like, I'm going to be one of those freaked out attendings in the beginning. And I think that's, I don't know. I don't know. I think that's what everybody says how the first year or two goes, right?
Yeah, yeah,
So I'm just bracing myself for that. Trying to figure out what I'm going to do in my life. But I'm so glad that it did this way versus what I thought it was going to be as an intern, which is I thought I wasn't going to make it.
yeah. Well,
Yeah.
you've made it this far, so I think you'll be just fine.
I think so. Oh yeah. No, nothing's stopping me now.
Yeah, there's doubts in every level. I mean, there's doubts when you're just switching a rotation, right? Like, and you have done that rotation in
Right.
the past, and you're like, man,
Right.
did I just forget how to do? Like, am I
Yeah.
good enough? But then you get yourself back. Just
Yeah.
want to switch gears a little bit. I want to ask you about some of your experiences that you might have had as a person of color. As you know,
Mm.
this field is not, we're not as represented. And so sometimes you can have some experiences that some of our colleagues might not experience. Are you willing to share anything that you might have experienced, if anything?
Yeah. I feel like I'm trying to choose one. I don't know. Down
It's like
to
it's more
like
than one.
it's down to like even your patients acknowledging you as their doctor or their surgeon. Like they literally have had conversations after being knee deep in their pelvis for 8 hours, doing the consent, doing all the things, and they're like, "But you're my doctor." Like they just can't compute that I was the one to do that, and they're like, "Hold on, the nurse is in here." Like after I just did all that, and I'm like, "Who's the nurse? Oh, it's me." Like that's where this is at, and no matter what, or there'll be a white med student in the back,
Hmm.
and they'll be looking at the white med student the whole time and being like, can you just ask the doctor? And I'm like, go ahead and ask him. Please go ahead and ask the med student what you think, because he doesn't know. He's looking at me for the answer. So there's like that part of things where it's like, I don't even, or every time I go up, they're like, there's no way you're my doctor. You look way too young. And I always say I take that as a compliment. I've been in school for many years. Really appreciate the compliment on the looks and the youth and the glow.
Hmm.
But you can't let that get to you because like clearly it's like where is that coming from, the patient fear, not being able to see us as doctors, and then who knew that like we're actually human beings on the inside. Wow, what a thought. um, Even when it comes to like scrub techs, your co-residents, the people even under you training you, trying to test you because they don't fully 100% believe you, even though they think you're a great senior and they love you and they think you're so fun. But when it comes to that OR and that hierarchy, they still put them above you because of that race. And I work with a lot of white women, right? Like I mean, OB/GYN is, I'm not gonna say the stereotype, but that's what you know. If you know, you know. That hierarchy very much comes into play when you get into the OR, even
Hmm.
down to like men versus women in the OR, which is interesting because I think there's been a lot of great male OBGYNs that I've trained under, and there's a lot of different reasons why men go into the field of OBGYN, and I don't ask everybody personally why. But sometimes people go into the field of OBGYN because they're a man and they know they can be a surgeon and that's the only reason why, right? Like I could be a male surgeon and not have to like compete with the other alpha males in surgery. And then when they do go into surgery, they mitigate or they don't listen to anybody. Even though there's like someone that's like a fellow that's coming in to do that specialty surgery with them, they're like, oh, I know everything, mansplaining. Those dynamics do not go away just because you're in the OR. In fact, I think they're heightened. I think you have to be very careful and explicit and learn how to speak up for yourself and that patient, even though it is so scary in the outside world to go speak into that white male that's older than you, and but you know deep down inside that something's wrong. It is so tough that you have to be the one to pull it out of you, but like that is why we're there. And sometimes if you don't speak up for those really intense moments, literally, like I've seen, and I, it's not like it's come from me. I've seen other minority women of color doctors speak up and being like, that's how it's supposed to be. That's how you're supposed to speak up. That's how you're supposed to be able to take care and protect patients. And then just learning also when to ignore things and let things move on because you clearly can tell it's not coming from you, it's coming from them.
Yeah.
Discernment, being a team player, all that those dynamics are so heightened in the OR. So I can't even. I'm trying to think of one example, and I really can't.
Yeah. I just it's very interesting for your field, especially when you talk about how men tend still feel like that's, a place where they can, I guess, show that kind of, I don't want to put it in a negative way, but
Of course,
yeah,
no.
but just because there's a stereotype where OB/GYN is, there's a lot of women who go into it,
Women,
and then yeah,
exactly. And
so
so
that's
then how
very
they can still exert so much dominance in a woman-dominated
yeah.
field where women sometimes don't even want men as their practitioners, but
Hmm.
somehow, some way, they find themselves at the top of the supervisor
That's
chain or like the lead surgeon, like, and then they get praised for it. Versus like women would never get praised for some of the same things that a man's getting praised for in those rights in those instances. If a woman came into the field of OB/GYN and said, I want to be a surgeon, would you think that's okay? No. Like they would be like, what? You don't like women? You don't want to deliver babies? You don't want to do STD tests? Like
mm,
that's not what's on their mind. But if a man does that, they'll be like, oh, that's so great that you are being able to help women with their fibroids and their hysterectomy.
mhm.
It's just like all those dynamics are very clear. And I'm one to just like peep game and move on with my life and know exactly how to move within the field. Not hating, I just realized like that's like a reality that you have to
Yeah,
face.
yeah. It's just
Yeah.
like a weird culture, I guess we have, all the
Yeah.
surgical subspecialties. Like when you look at the outside world, that's not how things work, but when you
Right.
come into medicine, you start to see all these, hierarchical
Oh
things
yeah.
and,
Oh yeah.
gendering and color, all those kind of stuff, which is unfortunate.
Yeah.
Just touching base more about giving advice for anybody who is potentially interested on going
Mm.
into medicine. I think you're one of those people who, you've been an influencer before influencing was there.
Dang,
So,
that's hilarious.
so many people have been following your journey just because of how you have
Yeah.
been mentoring people, not even just like one on one, but it's like
Yeah.
your overall page. I feel like does an amazing job of doing that. So thank you for doing
Thank you.
that.
Thank you. Thank you.
What advice do you have for, maybe a pre-med student or, a high schooler who says, I want to be a doctor. What kind of advice would you have for them and what should they
Yeah.
do at that stage?
Man, part of me wants them to be like the really cool gunner that like goes and interns at the plastic surgery office at a young age and is doing research papers in college and MCAT at third year, like doing it all right. And it's hard to me just wants people to follow all of their passions in life and see where it leads them and being okay with being reared off their paths because I think a lot of pre-meds, they in themselves send themselves into going crazy because it doesn't go the exact way that it's supposed to, which it will not. Down to the match. Like it keeps on going. It's past MCAT. It's past where you're getting accepted to med school. It keeps on going because this field is just so hard, so competitive. Everyone is so smart and genius. And I mean, they're like people that are CEOs of companies now applying to like it's just hard. I would say people to trust themselves, trust their path, understand that that one thing that has nothing to do with science is probably the one Achilles heel that's going to make them the best dive a doctor in that specific field. So don't try to numb that part out or get rid of it because no, you have to focus on medicine and you have to get the best bio grades. When in reality, the best doctors are the ones that have that plus this other little cool thing about them.
Right.
Add in dance, add in painting, add in opera singing, add in whatever it is. And you won't even realize that that opera singing career is going to lead you to be a neurosurgeon because of some weird thing that I don't know. You know what I'm saying?
You can be an ENT surgeon. We do a lot of
You can be an
voice stuff.
ENT. There you
Mhm.
go. Like, don't try to be like, but that's, I approached that way in med school. When I got into med school, I was like, now I'm going to be serious about my life. I'm going to not do this and not do that. I'm going to study and no more brunches. Like, who says no more brunch? To
Mm.
like, that's not what life is about. Life is about brunching after the really hard test with the friends and the family. And so, I think just to my pre-med babies and my med school friends that are going on this field, just know that that's all part of the path and the journey, and don't like you can cry for one day and get over it. Like that is a part of the process. Figure out a way to swing it. Go with it. Like life is literally the journey, not being a doctor. And the moment you let go just a little bit, just a little bit, you'll realize like the corner that you're supposed to be in. It becomes very clear. It stands you right in the face. And also just like understanding that this field is not, oof, it requires a lot of sacrifice. So when you choose what type of doctor you want to be, I don't ever put passion against wellness, but you must understand that those are different realities depending on what field you go into. So like us for surgery, you just have to understand that surgical training is tough and those sacrifices are necessary to it's what our patients deserve, number one. And you're gonna be grateful for the training when you get in those really shitty situations. Sorry if I'm not able to cuss, but get in those really situations where you're in the OR and you're like, oh my God. Like you have someone's life in your hands. My mom passed away from surgical complications. Like it affected my life forever. You don't even the gravity of the choice that you make is huge. I think that's probably the biggest thing that I'm battling right now is dealing with and accepting the responsibility that came with my decision, which was I want to have that level of responsibility in someone's life. And um I'm still trying to figure out the best way to deal with that, but I do believe that it's mostly really good for this field. So it allows me to continue to train and be better and better and better, knowing that every surgeon comes with, it's poor outcomes. I always say, if you don't have a poor outcome, you haven't done enough surgery. And to be able to accept to know, but you just, yeah, even with those things, you never know how much comes from that decision in the field of surgery. So I would say one, if you're going to choose surgery, understand what you're asking for, that level of responsibility. And then two, like really weighing how much you're willing to sacrifice in terms of wellness to get there for a short amount of time. This isn't forever. But during residency, if you're choosing a 4 year or 5 year or 10 year, whatever, like you got to get real with that. And other than that, just keep going. Like if my crazy ass could be an OB-GYN surgeon, pelvic surgeon, and be all up in people's pelvises for 8 hours, y'all can't. Trust me. That's what I said.
Or you're too nice to say that. If you can, you're more than capable, and you are amazing and smart, and I
Thank
appreciate
you.
you letting people and
Yeah.
encouraging people. I want to kind of highlight some of the things you said because they kind of hit home for me.
Yeah.
One is I feel like early on my journey on becoming a doctor has been is like this is like the thing. This is what defines me almost.
Yeah.
Think a lot of us fall into that, and I really want
Yeah.
people to like stop doing that because it's not
Stop
worth
doing
it.
that.
Like,
Like screaming at the top of your lungs. Like,
like you are not the medical, so you are not, you are Ben, you are, Camilla
yeah.
first.
Yeah. Yeah.
I think I wish I had that mindset before, but it took a lot of years of a lot of hard work and
Right.
being down and crying and depressed and realizing, okay, this is not who I am. This is just my job, right? You
When
know?
did that click though? Because I felt like I heard that from doctors, and then I just was like, "What are y'all talking about?" Like, my
Hmm.
dream is to be a doctor. Like, I just wasn't hearing it. And like, when
Yeah.
did it click for you? Because I'm sure you've heard it before, but when were you
Yeah.
like, "Oh, this is what they were talking about"?
I just have I've been more intentional like after my
Yeah.
junior years, like because my
Yeah.
PGY2 and PGY3 are so hard, and I was putting so much pressure on myself, thinking that
Yeah.
it's all this is all I am, and I just at some point I had to just come into realization, and I was like, okay, like this is just part of
That's
my job. There's other
literally.
things in life that like what you're doing, like I'm gonna freaking go travel. Like you should do
Yeah.
those things,
Yeah.
like don't
Yeah.
wait until you are retired at 70 when you
Right.
can, or you don't know what's
Now
going to
you can
happen.
go travel.
Exactly. So
After we take care of dying people all
oh,
day,
oh, yeah.
you know? I just
So
like I'm just looking around like life is to be lived right now.
right now, exactly, like
Right
as
now.
you said, like this is like a journey, and you have
Yeah.
to somehow find yourself in this journey and be okay with
Right.
the sacrifices that you're making, but at the same time you got to be okay with saying, okay, what can I do to enjoy my life? What are the hobbies that I have? What are the things that I've always enjoyed? There are
Yeah.
moments you might not be able to do that, but make sure you're finding time to do that. So
And they also make the time less miserable. Like, of course, if you're sacrificing everything and you don't
Yeah,
have any time for friends, family, anything, of course,
yeah,
7 years later, you're going to be like depressed and miserable. But if you've been actually keeping up with those things, your body, your mind, your mental health, your spiritual health, your love life, like you're not waiting until the end of training to be like, oh, now I'm going to
yeah,
go and focus on love. When at that point, like everybody is doing their
yeah.
own thing. If you wait and you put it off, then of course you're going to be miserable. Like it may not be that bad if you just start while we're on the journey,
Do it now.
you
Yeah,
know?
exactly. But yeah, well, I appreciate you. I don't want to take too much of your time, but I always
Oh
try to
no, just
finish
good.
with one of the questions I ask everybody. What's been the most rewarding thing so far in your career?
Oh, I don't think I've ever been asked that. Wow. Okay.
I know
The
you're like
most rewarding,
I'm still training, man. What are you doing?
right? I'm like, nothing. Getting off my 24.
you're you're like when I start taking 24-hour call, that's when
Right. Or they said, oh, you don't have to answer that page. Or this is just a bad sign. This is
yeah,
fine.
it's like actually we're okay with you not seeing the patient. We're just gonna
Yeah.
discharge
Those are
them.
the most rewarding parts. Those little gems. No, I would say the most important has just been realizing that it's been worth it. I don't know if that sounds crazy, but like everybody always asks me, like, was it worth it? Like that's the number one question I get, and I'm literally gonna
Mm,
block word worth in my phone because I can't see that anymore. But I guess overall, like, I feel like I haven't started paying for loans. Maybe that'll change my answer a little bit. But for a while, I was just questioning a lot about this journey and this path because it took so much. But then once you start to really get a hang of it, once you really start to connect with these really cool patients and realize the depth of your career choice, like it's not just pulling up to Subway, it's not just like getting the Best Buy done. It's like truly you're in people's lives within 10 minutes of meeting them. And then you forever changed by them, they're forever changed by you, and you do it over and over and over again. And then you can kind of decide what you want to do with that once you're done with the training. Like, I'm like, this is a very unique field. And I do feel like I was built for it. And I feel like I actually help people, like, really help people. And I really didn't want that. I wanted that in my life. I really cared about a passionate life. I'm a passionate person. Like, that's just who I am. So to choose something that not only I actually care about, like it actually worked out. It's actually what I wanted, weirdly. Now the training, F off. Like I can't with the training. But it's coming with the decision that I made. And then I got through the training. So now I'm like, well, I can do anything. Now that's something I didn't realize that I got from the training. I didn't even realize that I was getting that mentality from it. And it allows me to just keep going to do whatever I want. So I'm really excited. I feel like the most rewarding part has been realizing that I actually got to do what I wanted to do. Weirdly, even through training, I haven't been an attending yet. That's
yeah,
cool.
that's
Yeah,
cool. I feel like if I asked you this when you're like an intern or PGY2, you'd be like, bruh.
nothing. I probably would say absolutely nothing. Like,
You'd be like, actually, I'm questioning my life right now.
yeah, literally. Like, actually, no, seriously, I could not. I actually said that. People were asking, like, do you think it's worth it? And I said, I can't answer that right now
Yeah,
because
yeah,
I can't tell you if it's worth it.
I agree completely. There is just part of your training, surgical training especially,
Yeah.
where you're just like, why did I choose this?
Yeah,
Just for people who are
literally.
listening
It's
out
very
there.
hard to even convince
Yeah,
yourself. So it's very hard to answer the question for other people. You're either going to tell them nonsense or not the truth. And then you just
yeah.
be like, yeah, I don't know. Like, I just,
Yeah, it's just how it is. Like you're gonna go through moments where it's just gonna
yeah,
be maybe this wasn't worth it, but I think it's like
yeah,
now we're on the senior side of things. We're like, man, like look at all the skills that I've gained. Like somebody's
yeah,
gonna call me with an emergency right now, and I can handle that, and
yeah,
I can take care of them, and I can help somebody. I think that's kind of
literally.
where the power
And
is.
you're like right hand to someone. Like, it's just, yeah, even the way that your mind works for life is different.
Hmm.
You literally evolve as a human being.
You
And
do,
as long as you're able to take it and say and see yourself outside of being a doctor for once, you
yeah,
realize like I'm like really like my brain is like at 100% right now. Like,
yeah,
what do I do with this? And there's so many cool things you can do with it. And there's so many, yeah, it's just like it opens up life for you a little bit, I would say.
yeah,
So
yeah.
Yeah.
Last is Mila specific question. What's the
Yeah.
best place you have been to so far since you're a traveler?
Ooh. Okay, so actually the reason why I went back to Portugal is because it was in my top three destinations in the world. I was able to, my senior year of college, go on this uh study abroad, but it wasn't just in one country. It was on a boat for like 4 or 5 months. We went on semester at sea. We went to 15 or 16 different countries. And then from there, I was like locked into traveling. So Portugal was one of them, Lisbon, Portugal, Cuba, and then weirdly, this place in Poland called Gdansk, just because I loved everything about it. It was very, very cool. Those are my top three. And so I went back for my second birthday this year, like a week ago, to Lisbon, and I was like, I gotta go back. Like, it's one of my favorite places in the world.
Nice.
Yeah.
Nice. All right. Well, thank
Yeah.
you so much for your time again.
Thank
And
you. This was really fun talking about surgery with another Black surgeon. Please welcome me back anytime you need me to keep on Black and being about my life.
of course, we're definitely gonna have you back. Don't worry. I
Yeah.
think maybe at some point we'll just like pick a topic that you're passionate about, and we can just chat
Oh my
about it. You
gosh.
know?
I love listening to like podcasts on like women's health and all the little weird ingenuities. And I'm sure ENT
Hmm.
has cool things. Like, let's talk. Let's keep
Yeah.
doing these things. And good luck with the rest of your guests.
I
And I hope
appreciate it.
all these, I hope this gets to the right audience because we need more, okay?
Yeah.
Clearly, the way that we do it, the way that we
Exactly.
do it,
You
the
know,
music that we play, the
it's
way that
so
we walk in, the way that we wear our shoes, the whole thing,
the
the way we
playlist
treat
is
our serve
different.
techs. You already know. Like, this is the way that seriously, I have people walking up to me, like the other, all the other support staff in the room, and they're they are thankful that we're there. There's just so many cool parts to it.
I think that's I was talking to somebody and I was like, one of the best things is when I walk into a room and just somebody like dabs you or something, and they're
Yeah,
like, man, I'm so proud of
right.
you. And it's not even like a patient, doctor
No,
relationship anymore. It's like we're family all of a sudden. And
yeah,
it's like you're, vouching for me, and it's just,
yeah.
it's some of the best experiences.
It's the best feeling. We probably get that. I don't know about you. I probably get that every other day,
Yeah.
at
Oh
least.
yeah. Yeah.
It's a good feeling.
Hey guys, so thank you so much for watching another episode of the Black Surgeons podcast. If you haven't already, please subscribe to get more material like this. And also by you subscribing, it helps spread the word and for more people to view this channel. Again, we appreciate you guys, and we'll see you on the next podcast.